Trauma, I think that people think of trauma and that it's mental. And unfortunately, it's not just in the head, as people say. It truly becomes physical, and it starts, it mimics the GI symptoms. It mimics the neurological symptoms. It can even play, havoc on the gastro and cardiac systems. And it also can impact mental health and look like, so one of the diagnoses I was given was bipolar. It wasn't that I had those fluctuating emotions because of a chemical disorder. It was because I had it because of a trauma disorder. Mm-hmm. And all of that, I think that that's just the bigger understanding, is that you have to treat the whole, the whole person. You kind of had mentioned earlier about the ACE scores. I just spoke out in LA to Kaiser Permanente, and one of the things that I told the doctors is I think that we need to start having that conversation on intakes about people's ACE score. My ACE score was 9 as a child. That really gives an open, at least it should start a conversation of, hey, she has all of these things and we can't find out why. And instead of putting her on a medicine, maybe we need to kind of look at this, like an ACE score of 9. That really could be a part of this, because you have me having all these medical problems. I have mental health problems. I have addiction problem. It would be reasonable to have that conversation, but I think that people don't want to address that. So I think that that's the biggest thing, is to realize that maybe if we're having somebody, we can't find out what's wrong, maybe we need to have that conversation of what's going on or what has happened to them to kind of lead them there.